Dear doctors, my name is Deepak Mishra and you're watching 10 Minutes International. Since you're on this channel, I assume you're looking for more information towards post-graduation in Germany. Or for specialist doctors, you want to move to Germany for your further career with your family maybe. If that is the case, you are correct, you are at the right place. We have been doing that. We have been spreading information, sharing information for the last 3.5 years now. I would recommend you, first of all, to subscribe to this channel so that the information that we make, that the videos that I make reach to you directly without any delay, so that you can be updated, stay updated with the process. In this video, I'm going to talk about the hospitation, the 1-day hospitation or the 2-day hospitation, which the hospitals in Germany sometimes demand from the candidate who applies for the position of assistant arts. I will explain to you what is the process, what is expected of you in hospitation, how you should deal with, how you should behave during hospitation so that you create a good impression and probably get the job. This hospitation, sometimes the hospitals tell you just to come for an interview. They give you a date and time and place where you should come, and you come there, half an hour or 1 hour, there will be an interview. There will be maybe the chef arts, maybe one of the Oberarts, maybe few other people, 4-5 people maybe, and then that is the interview. Okay, there they will ask you common questions. They're mostly based on your Lebenslauf, that is your CV, what work you have done, what process, what are you doing at present, your work experiences, about your family, why Germany, why that particular branch. So all the normal general questions that you are expected, mostly based on your CV. Your hobbies, your extracurricular activities as well. So these things, I have made a video in our online course there about how to prepare for interview. If you want detailed information about how to prepare for interviews, you can book that course, enroll in that course as well. That's a very cost-effective course with huge amount of information, the link for which will be in the description section, that you can check it out. But going further about hospitation. If the hospital invites you for 1-day or 2-day hospitation, that means the hospital wants to see that how you behave. Do you understand German? So mostly, how is the hospitation? Mostly like it is hospital, you will be asked to come early in the morning. That means you have to book an overnight stay. If the hospital is far away, you have to be there at 7 o'clock in the morning. Then you have to book a hotel, or say Jugendherberg, that's a youth hostel, so that you can stay overnight. Then early morning you reach there. Don't forget to bring your apron. Aprons in Germany are full length apron, not the half ones that we have in India. Here, because the weather conditions allow that, so you bring a full length apron, dress yourself formally, and then reach mostly it is a secretariat, so secretary, by the secretary of the head of the department you have to reach. After that, somebody from there will take you to the Besprechung. Most hospitals start work at 7 o'clock, some starts at 7:30. So it's, depending upon your hospital, you will be told what time you have to be there. So arrange that traveling plan accordingly. From the first thing that happens in most hospitals is Besprechung, that is the morning rounds. In these morning rounds, there is a Diensthabender, that is the person who had 24 hours duty the previous night, like last 24 hours he has been on duty. So that person will report on all the cases that he has seen, all the important cases, the patients that he had admitted for surgical branches, the patient that have been operated, the patient that have been admitted as emergency has to be operated today, like on that day. So all the important descriptions will be given, and there will be sitting the entire team. So in the smaller hospitals, 10 people, maybe the chef arts, few Oberärzte, the assistant Ärzte. In big centers, there are 50 people sitting there. The chef arts, the Leitender Oberarzt, the 5 other different Oberärzte, like Abteilungsleiter, that is the head of the departments of different different sub-departments. For example, like in orthopedics, there will be one from trauma, one from endoprosthetic, one from spine surgery, one from foot surgery, so one from septic surgery, one from revision surgery, so one from plastic surgery. So in big departments, there will be 50 people sitting over there, and the Diensthabender, the person who had Dienst, will be explaining each and every case, and he will be asked questions. That did you do that? Did you do that? How was this? How was that? What is your plan? So that's a grilling basically. So that you will notice when you reach there on hospitation, you will see that how it is going on. Okay, that's very it is very intimidating. And there you have to think, when you see that first thing in the morning, you have to think that is that for me? Like, is this place suitable for me? Will I be in the position 6 months from now, or maybe 1 year from now, to sit in that chair and explain and make that presentation that this colleague is doing? And will I be able to answer these questions? So if the answer is yes, then that place is for you, as in for your side it is positive. Now you have to make impression that okay, they also accept you. But then if you feel that place itself, no, it's too much for me because of the language, because of the Faklish, there's a subject deficiency, I will not be able in that position, then that creates a negative from your side also. Like, okay, now, I mean, theek hai, I have come here, but then I don't know how it will move. So that is best pressure. After that, what happens is, different people go in different places. Some people who are like, I'm talking about surgical branch now, similar things happen in internist side also. Surgical branch, some people will go to the operation theater, okay, who are like already in the plan. They will go to operation theater. Some people will go on the wards to do the normal ward rounds. Some will go in the note of nama, that is the emergency department. Some will go in Sprechstunde. Sprechstunde is a OPD. Okay, so these are 4-5 like divisions where people go. Where you will be sent, that is, I mean, depending upon that day on the head of the department. Mostly hospitants are sent to the surgical hospital, are sent to the operation theater, because they want to see has this person actually ever been to a surgical like unit, a surgical like surgery room, OP. Has this person ever been? They see how you wash your hands, how you behave with nurses, how you wear the gloves. So they notice that do you actually have experience? Even then, even when your CV says so, maybe that's your CV, I mean, whatever is outside of Germany is not taken to 100% to their face value actually. Like, they always have a iota of doubt that, okay, is it really so? Has it really done that? They don't know. So they will actually want to see what you actually do. So first of all, whenever you go in a new place, here introducing yourself is very important. Whenever you when you come to a room, there are 5 people already sitting, and I mean, if you come in middle of a presentation, obviously you will not disturb that. But if you come there and people look at you, you will introduce yourself first of all. You will tell that, okay, my name is so and so, and I'm a hospitant for the day, obviously in German. Okay, so everything is in German what I'm talking about. So you will introduce yourself. If you don't introduce yourself, it's considered very, very rude. And because people want to know whom they are talking to, who is that person who is sitting in that room. When you enter operation theater, you first have to say hello to everybody, and you have to introduce yourself that I am so and so, and I'm hospitant for the day. Okay, only just 2 statements that breaks the ice, then people will communicate with you. Because if you just enter the room without speaking anything and stand on the side, you will stand there for 3 hours and nobody will even look at you, or even some nurse might even ask you, like, who are you, why are you here? And that becomes like little embarrassing. Then you have to explain everything. Okay, so better wherever you reach, like whenever you enter a place where you don't know people, even when you have started work, if you don't know people you're seeing them for the first time, introduce yourself. Okay, my name is so and so, I'm the new assistant arts, okay, in orthopedic department, for example. So that is about operation theater. In operation, you might be asked to scrub in. Sometimes you might be asked to just stay and watch, like you see what work we do. Okay, both are fine. Sometimes what might happen is that you will be sent to the note of nama, that is the emergency department. And in some small case, you will be asked to take a history. Like in internist side, I can say that, okay, somebody has come with cough and fever, so, or maybe abdominal pain, and then you'll be asked that, okay, you go and take the history from this patient, write it down on this sheet of paper, and come back to me in half an hour. Okay, so now that is their own way of taking the Fachsprachprüfung. They're not waiting, or they're not seeing that, okay, how good you were in your Fachsprachprüfung, if you have passed that, or if you are going to pass that, how is your preparation. They're not worried about that. They just want to see it themselves. Okay, please go to take this patient, and there you have to go and do what is told. Like you have to do anamnese, that's the history taking, the clinical examination, and document everything. That is what you have done. You would have done in your Fachsprachprüfung. That you have to do. That is. So after that, you go there, they will ask you questions about. That is also the knowledge-wise examination, basically. That if, for example, if you're applying for a GI, gastroenterology, and the person has come with, say, a provisional diagnosis of of GI bleeding, then they will want to know from you what tests would you do, what other procedures are to be done, what do you know about GI bleeding. So they will ask you in a simple way that, okay, have you seen these things in your home country? Have you seen that like any time previously? If you say that no, I have no idea, then they will not ask you further, like, okay, fine, you don't have no idea, you have to search another place. But if you say that no, I have seen that, then they will want to know you. Okay, so how do you guys treat this kind of for example, if heart infarct, that is a acute MI, so they'll ask you, okay, have you seen that previously? If you say yes, I have worked in ICU, or I have worked in internist department in my home country, and I have seen that and I have managed that before. So then how do you guys manage it over there? Like, do you so they'll want to know what you know about that case. Basically what they want to know is, do you know the protocol? Will you be able to like start working? How soon you'll be able to start working? These things that they want to know. So apart from the fachlich Kenntnis, that is apart from the subject matter knowledge, what else that they want to know is how is your body language? How do you smile when you meet people? Are you or are you very angstlich, very anxious person, or are you under very lot of stress? I mean, stress is normal; it's going to be there. But then you have to be very friendly. Are you friendly to people? Are you smiling to people? How is it? How do you move? Are you very lazy, lethargic, or are you very swift on your feet? So these things, that is what they want to know. How you communicate, like your language will be very high importance. That are you able to understand what has been told to you? And are they able to understand what you tell? So, and obviously when you meet different people during that entire hospitation, everybody will ask you about yourself, like from where you have come, what work you have done, why Germany, about your family. So same old questions that everybody knows. Everybody will be asking, and at the end, the same day, nobody will give you an answer what is going to mean. They will say that, okay, fine, it was very nice, thank you for your time and everything, and then we will let you know. They'll send you back home, and then they will discuss among themselves. And if they have other candidates who have come there, they will consider that also, that okay, how is your competition looking, and then they will like together decide. Like the chef arts will not decide it alone. He will talk to the Oberärzte, that is the consultants. He will talk to the residents also, for that matter, that okay, this guy, how was he? Like, did you understand what he said? Like, how knowledge wise, how was he? So, or she. So, entirely, then they will make a like list that, okay, fine, now they can choose like that. So this is my experience from the hospitations from that I have done myself. Some have been good, some have not been so good. But then, I mean, this is what what they tell you is that for you, if you are a beginner, you don't have much choice. You have to take the first job that you get. But if you have some experience, and if you are very like selecting, you're wanting to select the place, things that you have to look for is, how is that team? How is the stress level in that team? Because that thing is very important. The teamwork. Are those colleagues fighting amongst each other? Or are those colleagues very friendly and taking each other's work and sharing information, like being very cordial and very nice to each other? That is very important, because when you start working, those things are very important. As in your stress. If you are stressed during work, your performance will be bad. And if you have a very supportive team, which by chance I had a very supportive team when I began, and that will make your life much easier. They will understand that, okay, it's a foreign guy, language is broken, but I mean, he's hardworking, sincere, is friendly, most important, friendly to people, and then they will cover up for you sometimes. Okay, so you need to have that kind of team. So if you see that, first of all, if there is no Auslander, there is no foreigner, that means that acceptance for foreigner at that place is very low. That means if you want to make a place for yourself over there, you'll have to struggle actually, and be in good books for everybody. So that is what one has to consider. You see the spectrum, that the work that they're doing, is that the work that you want to do? Then if yes, then that is a place for you. You see how the Oberärzte are there. Are they nice to other residents, or are they shouting on them? Are they screaming at them? So these things have to be considered. Other thing is that how is the department? Is it too big or is it small? For beginners, I would say small department is good, because there you have to impress only like 7 people or 10 people to be in their good books and get you get the opportunities that you deserve. But then if you are going interviewing at bigger places and there's a 50 people over there, you have to impress those 50 people who have other 30 assistant arts over there, and then you are one of them. So you will be at end of that 30 assistant arts, and you have to compete every day with those 30 people. So for beginner, I'd always recommend smaller hospitals, smaller centers, even though the spectrum is less over there, but still for beginning it's okay. So yeah, so in Zusammenfassung, in summary, I would say, if you are invited for a hospitation, be prepared with your interview questions first of all, because those are going to come very often. With everybody is going to take your interview. Okay, that be formally dressed, be punctual, and introduce yourself to everybody. Nowadays, like, we don't shake hands because of corona, but initially it was so that even the Putzfrau, even the cleaner that they come, okay, the hospitants, that the German hospitants who come to, like, what I have noticed in my hospital, in my previous hospitals, they also behave like that. Every person that they see, they just go and say, hello, I'm so and so, ich bin, for example, Clemens, or ich bin Deepak. Yeah, so hello, I'm so and so, and I'm a hospitant for the day. So that is what they do. And this, with small one sentence, you break the ice. That person might forget your name, okay, might forget your face also, maybe, but Indian face or foreigner's face, they don't forget very easily, but might happen that they don't know you anymore. But then, since you have spoken to them, they know that you have at least introduced. That means you're not rude. That is what they know, and that is very important. Okay, so if you have not introduced yourself, these things, the nursing staff, actually, they don't play much role in your selection at the beginning, but later on when you start working, they play a major role, that if you stay or you don't stay, that 6 months. So because they are going to report to your colleagues, to your seniors about you, the way you behave and the things that you have said and things that you do. So it's very important to be friendly with the nurses. So, and if you have not introduced yourself in the beginning, right at the beginning, then that is going to be a negative impression. They are going to talk among themselves that, okay, this doctor, he have not even introduced himself. And I have heard many people, they talk that about consultants also, who have come and started talking to them without introducing himself. And that they find it very rude, that, okay, what does he think of himself? He doesn't need to introduce himself or what? So when you go every place, you introduce yourself. That is most important thing that I would like to say. And other things, other things are not that, I mean, other things are are self-explanatory. You have to be nice to people, show that you are fast, improve your language. When you apply for internal medicine, then you learn about that branch. You study for a Fachsprachprüfung as it is. Then you prepare that it might happen that they might give you a stethoscope and tell you to go in that room and take history and come back. All right, this is what I wanted to say about the 1-day hospitation or the 2-day hospitation, that you might be invited sometimes, and that is going to play a crucial role. I have done several such hospitations, as I have told, and I have gained different experiences through that. And in summary, I have mentioned in this video. Thank you. And I conclude this video here. Important, once again, go through the videos here before writing to me on Facebook or on Gmail, or consulting my company, directly asking your questions there, because I have seen like the messages that I give, the same thing about introduction, that messages people write on Facebook is that, hello, yeah, so I have done A2, and now how do I apply for deficit Bescheid? I'm like, what is this? At least say hello, at least say what your name is, at least say who you are. I mean, there's no head and no tail to those questions. Like, okay, I have done A2, I want to apply for deficit Bescheid. How do I do that? I try to be very not arrogant. I try to be very polite, and I ask sometimes in reply. So most of the times I don't reply back to such questions, but I try not to be arrogant. Like, arrogant answer would be like, why should I reply to you? That would be an arrogant answer, but then I don't do that. I try not to. Sometimes when I lose my temper, I do that. So yeah, that is important. And other thing is that people who are thinking about Germany, PG in Germany, career in Germany, the online course that I've already mentioned, it's very recommendable. It's very cost effective. I'm trying to automate things so that you don't have to spend thousands of euros in consulting programs. So that I'm trying to automate things, putting information together, so that if you have that, you have the information. You don't need to ask consulting companies. And for consultants, for people who are running consulting businesses, for you also it is very important to have that course, so that you can guide and motivate your candidates effectively and correctly. All right. Fine. Thank you. Bye bye. Have a nice time.